Good afternoon, everyone, and welcome to this afternoon's PP Week session. This is a session that we've organised here in the Psychological Professions Network in the South East, and in a moment I'll tell you a little bit about what we're going to be covering today. Our aim really is to talk about career routes, and in particular to talk about some of the newer career routes that exist in the psychological professions. We're going to talk about some roles that you may or may not already have heard of, and I suppose emphasise just how varied different routes can be that can bring you into some of these roles, and what interesting and dynamic roles they can be. So a few notes of housekeeping first of all, and for that let me introduce myself properly. So my name's Bill Tiplady. I'm a consultant clinical psychologist. I work in Oxford Health Trust, where I'm the Chief Psychological Professions Officer, but I'm also the co-chair with Adrian Whittington of the PPN in the South East. And as I say, this is a South East led event this afternoon, which we're very excited to put together for you. So in terms of housekeeping, we hope that it'll be possible for us to hear many of your questions. We're going to come to you for questions after each of our segments looking at different professions. I think in the view you've got, you should have a Slido window, so do use that to submit your questions and those will come through to me. Obviously, as there's technical issues there's a note there about who to contact, First Sight Media, who are organising the session for us. The session is recorded, so do post anonymously on Slido if you don't want your name to come up, and we'll be sending out more information at the end of the session about how you can access some of the materials that we've talked about, and obviously the attendance certificate. So in terms of the actual content for this afternoon, so I'm going to say a little bit about the PPN career map. So this is a resource that we're really proud of in the PPN and that we think is a really, really useful guide to the different psychological professions that exist. And of course, the reality is that that is a group of professions which has grown over time and is continuing to grow. In fact, we've got some updates needed to the career map, but the career map is a really good way of kind of digesting that, and I'll show you a bit more of that in a moment. Then we're going to talk about some of the different roles. So we're going to talk about the mental health and wellbeing practitioner role, the MHWP role, and we've got a really great bit of film with Karen, Sam and Millie, who are going to tell you a bit about their experience of training in and conducting training of those roles. We're going to hear about psychological wellbeing practitioner or PWP roles. Lauren's going to share her experience of working as a PWP. That's a more established role, but still one that I think perhaps people would be interested to know a bit more about. And then finally, we're going to talk about a role working with children and young people, the education and mental health practitioner role, EMHP. And we've got Freya and Saba who are going to share their experience of working in that role. And all of those people who are appearing in the videos, I'm really pleased to say, are joining us here in the kind of presenting team today. So you'll be able to hear them directly respond to your questions and your comments. So this is the career map. So it's an attempt really to summarise all the different psychological professions in one place. You'll notice that this is not complete. There are some roles, including the MHWP role, that we haven't quite got into the map today. We're working hard to get all of the roles into the map, and it divides up the different roles into different kind of overall categories: the practitioner psychologists, the psychological therapists, and the psychological practitioner roles, which is what we're going to be hearing about today. And you can go through and look both at those different roles, but also in terms of who you are and where you're coming from. So are you a psychology graduate? Are you another graduate? Are you a non-graduate looking for a role in the psychological professions? And there are routes for all of those. Or are you another mental health professional, perhaps looking to change direction into the psychological professions? And the career map kind of guides you through in terms of what your options are. You can have a look at this map and check it out for yourself, and do that. Don't let it make you lose focus from our session today, please, but do go over and have a look at it, and the web address is there, and there's a QR code that should take you through there. So that's, I suppose, what I wanted to say about the career map. The other thing, I guess, to flag is that we're developing some really nice short videos which give a bit of an account of what working in each of those psychological professions might feel like, because we think that's a really good way of kind of bringing that to life. You'll see links to some of those on the career map, and you might have seen elsewhere, if you've been tuning into PP Week, that we're really actively looking for other people to contribute some of the material to the process of developing those films. So we'll make sure we send that out after session, and if you're able to contribute to that, we'd really, really welcome that, because having the voices of people who are practicing in those roles helps us make those video animations come to life and really representative. So I think at this point in time, I'm going to hand us over to see our first film, which is Millie, Sam and Karen talking to us about the MHWP role. And then after that, we'll cut back to Millie, Sam, Karen and I, and we'll be able to take your questions. So do really make sure that you're getting into Slido, sending us your questions, sending us your observations, and then we'll be able to respond to those after we've had a look at this film. Thank you very much.
Hello, I am Karen Veri. I am the MHWP, the Mental Health and Wellbeing Practitioner Programme Lead within Oxford Health Learning and Development Department. Our programme is in partnership with Bucks New University, and with me I've got two students from our first cohort, so I'll hand over to yourselves to introduce. So Millie, if you want to start.
Hi, I'm Millie Boon. I'm cohort 1 of Mental Health and Wellbeing Practitioners. I'm based in Eastbourne at St Mary's House in East Sussex.
Thanks, Millie, for joining us. And Sam.
Hi there, my name's Sam, and I work at New Park House in Horsham as a trainee mental health and wellbeing practitioner. Yeah, me and Millie are in the same cohort.
Today we're going to be talking about the Mental Health and Wellbeing Practitioner role, or the MHWP role. And this is part of the NHS long-term plan, which endeavours to integrate primary and community mental health care. So the idea is that this will increase access to psychological therapies, will improve physical health care, will also provide employment support and personalised trauma-informed care. That will also include things like medication management and thinking about managing self-harm and substance abuse. So the kind of two main goals or aims of the MHWP role is to support people with severe mental health difficulties alongside family and carers. So that should be collaboratively planning care. But also then delivering wellbeing focused psychologically informed interventions, and that's evidence-based interventions for those with severe mental health difficulties. So if I hand over to Millie, do you want to say a little bit about the MHWP role and what that might look like day to day?
Yeah, thank you, Karen. So the MHWP role is based within secondary care, and it very much focuses on working collaboratively with the service user and their family and carers to ensure that they get the best care possible. So it's really about making sure that it bridges the gap between sort of coming into the service and hopefully being able to access longer psychological interventions as well. So we're sort of the middleman in between there and working towards helping them reduce perhaps the risk and perhaps reduce the need for psychology interventions in the long term.
We cover behaviour activation, graded exposure, problem solving skills, improving sleep, recognising, managing emotions, building self-confidence, and also guided self-help for binge eating and bulimia. So I suppose within our day-to-day, depending on our patients, we will work with them within that short-term psychological intervention.
I wonder if you can say a little bit about your particular journey to becoming an MHWP. So just to provide a bit of context, it's outlined that MHWP trainees do not need to have completed any previous mental health experience, and the programme can be taken at either a level 6, which is a graduate level, or a level 7 postgraduate level based on previous academic qualification.
So I went to university, I graduated in 2014, but I was studying sports, science and media cultural studies. So it's very different to psychology, but I actually took a sports psychology module, and that's kind of what opened my eyes to, I suppose, the world of psychology and kind of sparked my interest. So I started working in a children's home, and that was extremely challenging. If anyone's knows about children's homes and kind of what is involved. But from there, working with the children who have emotional difficulties, I then became an OT tech at a place called Shepherd's House in Worthing, and that was really great experiencing in terms of getting insight into the mental health field and what's entailed, and I really, let's say, valued that experience there.
Thanks, Sam. What about yourself, Millie?
Yeah, so similar to Sam, I'm not from a psychology background or mental health background. So I studied criminology for my undergraduate degree, and then I also have a master's in criminology and criminal justice, both of which sort of dabble in psychology with a few modules and sort of the work that we sort of learnt within, especially to do with society and sort of common problems at the moment. And then from this, at the time I was working as a youth worker, so there was a lot of mental health at that time, especially with the age that I was working with. And from there, I went and worked for youth charities as well. So again, working with young people who had mental health issues and difficulties.
Do you want to say a little bit more about what attracted you to this particular role as an MHWP, Sam?
Yeah, definitely. I think it was almost like, let's say, be cheesy and say it was too good to be true, but it just kind of encompassed everything I was looking for.
Very similar to Sam, actually. I think I've always wanted to work in mental health. The MHWP role really focuses on sort of the here and now for the service user. So a lot of mental health work focuses on their diagnosis and sort of everything surrounding it. But the MHWP role really focuses on perhaps what's going on in their life now. And that really attracted me to it, because I think mental health is a really fluctuating thing, and things that happened sort of a year ago aren't happening for them now.
It's really lovely to hear you both kind of reflected on how it's a great opportunity, and actually without, this kind of training program where there are or aren't rather stipulation about previous experience, this has actually given you, as you said, the opportunity to engage in training where you may not have been able to before. So just to talk a little bit about the training itself, of course that takes place over 12 months, and there are 3 modules throughout the academic year. The first module focusing on being able to assess and engage patients. The second module then looking at the collaborative care planning process, and then the third module being the one that focus on those wellbeing focused psychologically informed interventions. And alongside that, throughout those 3 modules and throughout the academic year, you are then creating a clinical practice outcome portfolio where you are demonstrating 8 particular competencies, and those are being signed on your supervisors in practice. And the programme is very varied in terms of its delivery. There are teaching days, there are self-directed study days, and directed learning days where there are particular tasks or activities that might be individual or in groups. And there's lots of role play practices, which everyone's always very happy to hear, and lots of interactive activities and quizzes and things to make the sessions really engaging. So I wonder if you can say a little bit about how you've been finding training, Sam.
It has been really good to kind of use the approaches and the materials and everything that we were taught, and then so we did that on the Monday, Tuesday, and then in the next 3 days we're in service, so we can somewhat implement what we have been learning, and kind of allows us to understand the theory and it into practice.
The way everything is set out, you learn sort of the basics of mental health and what sort of all the perhaps difficulties are at the very beginning, just to refer people or to provide background for people that aren't from mental health and psychology backgrounds as well. And as you progress over sort of course, things will start to slot into place a bit more of why interventions are used for those types of difficulties. And then I think having the assessments, so we've done role plays, that really helps to sort of integrate why you're doing the interventions and how to do it practically as well, because once you sort of practice it on yourself, that really helps to provide a better understanding for the client and perhaps the difficulties that they might struggle with as well.
So it sounds like you're referencing the self-practice, self-reflection there, where you're able to practice the psychological intentions on yourself. And then we have those group tutorials to talk about what you've learned, what the challenges were, and how you might be able to overcome those challenges when you're working with a patient in practice. And it sounds like that's been a really helpful process to not only understand the intervention, but also to be able to apply that theory, as Sam was saying, to the patients that you're working with within the community mental health teams. So I wonder if you can say a bit about what you like most about your role, Sam.
Definitely for me is that work with the patients is definitely what I enjoy most within the role, and being able to work with them to help overcome their problem.
For me personally, it's getting to work with a variety of people, so whether that's service users or colleagues. So I've definitely met some really interesting people that I think that I will never have been in contact with if I was stayed in my old job. So that's perhaps my colleagues, so mental health nurses, psychiatrists, other psychological professions, and then also obviously the service users. So perhaps they're not people that perhaps you would sort of even know would have mental health difficulties sometimes, and I think that's really important to understand that mental health affects everyone.
I wonder if you could say a little bit about what the challenges have been within the MHWP role. As you've highlighted, you are the first cohort of students. This is a new role, a new program, new assessment criteria. We've had our difficulties, but I wonder if you could say a little bit about what that's been like, or what those have been for you personally. Maybe Sam, if you'd like to start.
Yeah, as you highlighted, I think it's when you get there into service and you are a trainee mental health and wellbeing practitioner, and no one knows what that is, because and then you have to explain. And initially, you're like, a brief summary of what it is that you do, but it's still a brand new role, so it's kind of creating it. Like we're the first cohort, we're sort of creating and putting the footprints down for future mental health and wellbeing practitioners. So that was definitely a challenge, having that identity. And though other roles kind of cross over what we do.
Absolutely. So in that period where there's a lot of uncertainty about what the role looked like, that was a particular challenge in everybody understanding what that looks like, including yourself. What about you, Millie? Any other challenges that you encountered?
I was going to say the exact same thing as Sam. So, but I would also add in the balance between study and practical work as well. I think for quite a lot of us, that was very different from previous roles that we'd been in, and quite a few people in our cohort hadn't studied for quite a number of years as well. So I think being able to put yourself back into the study brain was quite difficult, and then having to focus on sort of switching to practical brain and being in service, that was quite a challenge to begin with. But I feel as we've progressed, that's sort of just become part of it, and you sort of get used to being in that brain.
Or towards the end of we're coming towards the end of the program, and you're maybe starting to think about what things might look like when you qualify. So Millie, do you want to say a bit about that?
Yeah, it's quite a scary idea to think that would be qualified soon. It's gone so quickly this year already. For me, my long-term sort of career goals would just sort of to see where this role takes me, and to hopefully progress within the MHWP role, whether that is perhaps being a supervisor for other cohorts, or further work down the line in other services, or sort of just further MHWP work in general, really, within the psychology profession.
Developing that confidence and kind of being able to carry that through and just be the best MHWP I can. At the moment, that's where my eyes are kind of fixed, so I don't tend to look too far ahead of that. But it's nice that there are further opportunities, again, like potentially be a senior, and being able to sort of guide the future MHWPs.
You will move, once successfully completing the course, to a band 5 permanent position within your teams. And with the MHWP role, it is funded by Health Education England. So there is the stipulation that you do have to wait 2 years post-qualification in order to apply for any other Health Education England psychological training. You have any top tips or any advice for anyone that's looking to join an MHWP programme, Millie?
I would definitely just say go for it. If you have any doubts or are a bit nervous about applying for it, just give it a go. It's a really great course and you learn so much on it, and it really doesn't matter if you have no experience with mental health or psychology, because that's the whole point of this training, is to go through it all. And if you do get the role and get onto the programme, ask questions, ask so many questions, even if they seem like silly questions, because they're really not, and it will really help you.
We always embrace questions and encourage them. And what about you, Sam? Any top tips or advice?
Yeah, don't know if they're top tips, but if you're interested in psychology and helping people, then I think this is a very valuable role. That's what drew me to it, and I think that, again, as Millie said, if you're interested in what I just said, then there's definitely a potential for you. And again, when you're doing it, if you get to that phase, make sure you're organised, because that will definitely help. And yeah, like I said, it's definitely a valuable role that we're doing here.
Great. So your kind of key tips there are being organised to keep on top of everything, but also asking lots of questions. And thank you both very much.
So, I mean, thanks so much again to Millie, Sam and Karen for recording that for us. I think it's just fantastic in that it gives a real insight, I suppose, into some of the challenges of the MHWP role, but also some of what has made it a really good experience for each of you. I think we've had loads and loads of interest coming up in the Slido and loads of questions, which is fantastic, and we'll get on to those. One of those, which I can pick up straight away, was asking, is this funded? So yes, absolutely. So the MHWP training is a centrally nationally funded training, and you're paid in role whilst you train. So it's definitely something that it's not a kind of self-funded route in any way. It's a fully funded route. Someone else was asking about, how can I apply for these roles? I think that person was from the Midlands. Usually these roles are recruited into by trusts, although the training is provided either by universities or in Oxford Health's case, actually by the trust as a training provider. So certainly a shout out to any Midlands PPN colleagues out there watching. You might be able to tweet maybe with some more information about what's going on in the Midlands, but look on NHS jobs for these roles. That's where you'll sort of find them. They're advertised as NHS roles by trusts. So coming back then to questions for today. So the top voted question is, how does an MHWP role differ from that of a PWP? Now, what we can do, of course, is we can ask Lauren about that in a little while. She'll have seen this video and she knows an awful lot about the role of a PWP, but also so do you, Karen. So, I mean, I'm really intrigued to know. I mean, my question was going to be, what's it been like for you moving from your kind of core role as a PWP into doing this training role with MHWPs? But I'm also really interested to know, how would you characterise the difference between those roles? So I'm going to come to you, Karen.
Yes, so I think one of the things I would say are the key differences are the client population that MHWPs and PWPs, Psychological Wellbeing Practitioners, work with. So with the MHWP role, that's situated within community mental health teams, so working with individuals with sort of more complex needs and more sort of severe and enduring mental health difficulties that they might be presenting with. The interventions that the MHWPs are using are evidence-based and are tailored to be able to be used with this client population, and I'm still sticking to that sort of short-term intervention, which is where there's the overlap with the psychological and wellbeing practitioner role. But of course, with that role, they are situated within improving access to psychological therapy service, which is primary care. So again, working with sort of more mild to moderate presentations that perhaps individuals like Millie and Sam will be working with. I think you mentioned there also about the transition, and there is a lot of overlap. So in terms of what you would be doing, you in essence will be assessing and engaging patients in both roles, and you will be thinking about the appropriate evidence-based or appropriate NICE recommended treatments for those individuals that you're working with. But of course, as I've mentioned, that those interventions being tailored for different presentations and different levels of complexity.
Thanks, Karen. That makes a lot of sense, I think. Another top voted question, which I can kind of answer fairly comfortably straight off, was saying, can people with mental health problems train in these roles, or does having mental illness exclude them from training? So I would say absolutely that is not the case. I mean, clearly, you know, whatever role you're coming into, you've got to be sure that you're ready to commit to a process of training, but having your own experience of mental health difficulties absolutely doesn't preclude you from these roles, and in fact can be a great strength in coming into some of these roles. I've spent a day with each of our MHWP cohorts so far talking about, you know, the different mental health difficulties they're going to be working with, and one of the things we really focus on that is hearing first person narratives and lived experience of serious mental health problems, because I think understanding those problems from a first person perspective is really important and can be really valuable. So I can definitely say that's the case. The question I'm going to put to Millie and Sam, and I'll welcome an indication from you, Millie and Sam, who wants to come in first and answer, is Emma Smith has asked, how did you find bedding into a new role into your trust as you were training? So I suppose, what was the experience like of getting settled in at trust level? Millie or Sam, you nodded slightly, Millie. It's like an auction here. If you twitch, then you find you've bought the item. So Millie, I'm going to come to you first on that one.
Lovely, thank you. So to begin with, I think for any new role, being the new person in a role is really difficult, especially being in a trainee role that we were the first cohort for and sort of the pioneers of the role as well. And to begin with, the services were a bit apprehensive, I would say. Perhaps they don't know where we would fit in and how we would slot in, and perhaps because of the uncertainty around how the intervention work perhaps differed from PWP work or the graduate mental health practitioners work as well. And there is a lot of crossovers, but a lot of differences as well. So it just sort of finding our feet, especially for me, sort of just making sure that you went around shadowing everyone that you could. I think everyone was sick to hearing me saying, can I follow them around for the day? But yeah, I just shadowed everyone, made sure that I got my name and my role out there, and understood what other people within the service and my colleagues did. So what all the sort of the nurses and the psychiatrists did, all the different roles within that. And that was really valuable for me to be able to understand sort of further my knowledge, and also for them to just get to know me as well.
Fantastic. Thank you, Millie. That really helps, I think, and makes some sense of that. I noticed you said pioneers. That's another comment that's coming on the Slido. People saying, you know, you're the pioneers of this new role. Congratulations. I can't quite find the comment because I'm trying to multitask and do too many different windows at once, but it's good that that's been noted. I see that there's been a response from the Midlands PPN about opportunities in the Midlands, so it's good that that system is working. Sam, I was going to come to you with another question, and that is, what are the personal qualities that a person might need to get onto the MHWP role, but also, I guess, to thrive in the MHWP role? So, Sam, what would be your thoughts on that? What sort of personal qualities do people need to bring into this role?
Can you hear me okay? Yeah, cool. So not to say that I reflect all of these personal qualities, but I like to think fit in there somewhere. But definitely having a strong level of empathy is, I think, the key within this role to be able to do it as best as possible. And again, it's kind of having that real interest and curiosity and willingness and motivation to help people. Because it isn't a case of always going simply patients turning up to each session week by week due to their own individual problems. So it's kind of having that willingness to carry on and kind of see where the problems are. So definitely having that motivation to really help people say solve their problems, but at least help with what's going on that side of things. And again, having that friendly, approachable kind of personality, where, because again, these people are patients and clients that we see, they're opening up to you, so you really need to have that key listening skills to understand what it is that they say require, but need help kind of on their pathway. So I hope that answered a little bit of that question.
Thank you, Sam. Yeah, I think that's a good answer, and I do think it's a good question in a way, because I think your personal qualities are really what's kind of important, what you bring into this sort of work. Actually, that sort of sits behind the idea that, you know, these are, I think both of you came in, as you said in videos, from slightly different angles in terms of your previous study. I think that brings a real richness to the role, and it is possible to come into these roles certainly without a pure psychology degree background, or indeed, as Karen was saying, you know, from a non-graduate route. And actually a lot of what's really important actually is your willingness to engage with this sort of work, I suppose, and with direct work with people, and working in a really flexible way to try and understand people's needs and difficulties and find a way to help. I can see that the quote about the pioneers thing was somebody saying, great, you're putting down the footprints for others to follow into these roles, pioneers. So there you go, that's some validation of your pioneer status. One final question then for us to think about before we go on. We've had a question here: can practitioners help me understand about any teething troubles that you've experienced in these roles? So, I mean, I'm aware from conversations that we're having in Oxford Health that, of course, there are some teething troubles of these new roles in terms of bedding into services, but I don't know, Karen, Sam or Millie, do any of you want to say anything about teething troubles that you've been experiencing?
I'd say from my perspective, in terms of teething troubles, I would question anything that's not such a big and important and new role to have any. I'd say it's a brand new role. Not everyone fully was understanding exactly what we would be doing, because at the end of the day, other practitioners and care workers have their own roles that they kind of need to take care of. So it's, as Millie said, shadowing, speaking to people. That was a good way to overcome that, just so you can kind of build that understanding that everyone is aware of where you will fit in. And again, it's a time element, and I think, again, pioneer is quite a statement to say about yourself, but now that there's that first cohort, it will naturally kind of eliminate those teething issues, I would say. I'm not sure, Millie or Karen, what you think.
I think we're not quite hearing the sound from...
Sorry, I do apologise. I would agree with a lot of what Sam has said there. I think there's a lot of change within the NHS at the moment, and it is something that's evolving, and especially within the community mental health teams. So I think, and you'll be covering some of the other roles, I think there are a lot of new roles that are coming about at the moment, and that naturally causes some confusion, some anxiety. What are these roles? Where are the overlaps? Where do the remits lie between who does what? But it's something that, you know, as Sam said there, now that we've got the first cohort, things are more established. Hopefully, as we go forward, you know, we're all quite hopeful that, you know, in 10 years' time, the MHWP role will be just as established as the PWP role within IAP services. So I think it's just somebody has to be first. So, you know, it's a really great, you know, I'm really happy with the term pioneers. I think it really well demonstrates what these guys have been up to.
I think that's exactly right, and I think, you know, it is a new role and it's fitting into an existing service structure, and so I think it's inevitable that there's some really good conversations to be had there about how does it fit in with other traditional and more established roles? How might those roles flex then to kind of make space for the unique contribution that MHWPs can bring? It's definitely a work in progress. So look, I'm aware there's other questions we haven't yet responded to. Some of those we might be able to come back to later on, but for now, I'm going to give a big thank you to Karen, Millie and Sam, and we're now going to go on to our video about the PWP role, and we're going to hear from Lauren. So over to Lauren.
So my name's Lauren Easton. I am a senior PWP or Psychological Wellbeing Practitioner at Southampton Steps to Wellbeing. So we're mainly based kind of just in the heart of Southampton, which is in Hampshire. We work sort of short-term therapy with clients with maybe mild to moderate symptoms of low mood, anxiety disorders, stress, that kind of thing. We work with people who aren't necessarily a risk towards themselves. Sometimes we do assess that, but within treatment, we'll be delivering what we call low intensity CBT interventions, often called guided self-help. So that's a little bit like, so say if we were a personal trainer, but for people with their mental health, so we teach them different skills and techniques to manage their symptoms. They go away, put them into practice. They come back to us each week. We talk about how it's been going, give them the next steps, and a little bit sort of like coaching people through these CBT interventions, essentially. We work under the what is called IAPT services. So I think stands for Increasing Access to Psychological Therapies, which is, I think it's been going for sort of 10 or so years. It was a fairly new sort of system to help obviously improve people being able to access their psychological therapy. Mostly we are kind of within that IAPT service, which tend to be an office environment. Maybe 80% kind of phone or online working, and then maybe once a week we would do like a face-to-face in-person clinic, but there's quite a lot of telephone and online working, which is quite nice really, but it's more kind of that sort of office-based with some rooms, clinic rooms, rather than based in hospital or anything like that. So I've probably had a little bit of a different start to most really. So I didn't go to college when I was, younger. When I was sort of that age, I went and worked in a hospital. I worked in a private hospital kind of within physical healthcare. So I worked in theatres as a healthcare assistant. And I sort of got to that point where I thought, if I'm going to move on, it's kind of like nursing or something within that field. And I'd always been interested in psychology. So I thought, actually, I'm going to pursue that route. So I went back to college at kind of age 23 to get an access course so that I could then access going to university. So started university when I was about 24, did my undergraduate at Southampton Uni in psychology. Following that, I then was kind of continuing to work within the hospital for my whole undergraduate and still worked there afterwards, and luckily kind of had sort of some connection with some of the consultants there who managed to put me in touch with some people working in the hospital, so psychologists that worked in the health kind of department, and I managed to get some voluntary work there. So I did probably maybe 8 months of unpaid honorary sort of post as an assistant psychologist, which just is generally kind of helping these psychologists out with kind of their caseload. Did a little bit of a kind of study, maybe do some questionnaires with some clients, that kind of thing, which then enabled me to be able to kind of have the requirements to be able to apply for the PWP job. You don't want to say, that cliche to help others. I've always been interested in like maybe kind of how our lifestyle would impact our mental health or our physical health. Worked from a young age in that hospital environment. I like giving people that information and knowing that giving them that kind of hope that they've got help and they've got options. So it's quite a full-on year, also academic year really. It's you work full-time as well as doing the course. So you have you go to your service where you're employed, much 4 days a week where you're working, then the other day you go to uni, and then you kind of have a portfolio to fill in about sort of everything that you're learning at work. You have kind of like mini essays and then also a fair few academic essays. You would also submit recordings of maybe a treatment, or you would do a sort of a staged assessment, so with like a stooge where they assess how you would do an assessment. So there's quite a few aspects of that alongside working in the field and learning it on the job. So it was quite busy. I think if you know, if you're organised and just try and enjoy it, it's okay. It's really interesting at the same time as well. It goes really quickly. It's kind of almost done before you know it. I think the profession of a PWP is quite nice, that you've got others around you. You work as part of a wider team rather than, say, having your own clinic, just you on your own. I mean, as you can probably imagine, you get to speak to so many different people every day. We're talking to different people that have been through so many different things, different people in different kind of walks of life, cultures, elderly people, and everyone is different. So I quite like that. Obviously, helping people feel heard and listened to, and almost that, overcoming that stigma of mental health, sort of reassuring people that it's okay to talk about this. It's busy. It's full on. As I said, those very high caseloads. We get a lot of referrals. We do a lot of assessments. So there's a lot to remember and there's a lot to do. Essentially, you've got to be kind of quite organised. Probably the other thing would be that sometimes you have to hear difficult things, that people that have been through traumatic situations, upsetting things, which can be just quite draining, emotionally. With that space for supervision, you have that kind of place where you can talk about that, you can offload, you can go to supervisors. If you've had a difficult call, you could reach out to someone and say, is there anyone I can just have a chat with and just debrief? And so we have space for that as well, but it can be quite hard. For myself, I'm one of the senior PWPs at the moment. I might kind of would lean more towards the management sort of supervision side of things within IAPT. But again, I'm kind of just happy where I am at the moment and just going to see how it goes. I guess just be prepared for the high caseload of how many people you have to see and you have to speak to daily. And, like I said, that those things that you're going to hear is quite hard. Words of advice for anyone who wants the job and is applying is to try and have some experience in mental health, or having dealt with people who are maybe at risk towards themselves, or using kind of the diagnostic questionnaires for kind of low mood or anxiety disorders. I think having that experience working with people in a similar kind of role is going to be what's going to give you that step up. I know came from doing their degree and then working for Samaritans, mental health charities, hospital sort of settings in terms of a psychology setting, any kind, no limits counselling services, anything like that really. One thing just to note actually is that you don't have to have done a psychology degree to do the PWP course. Just go for it.
Wow. So thank you, Lauren. I think obviously PWPs have been around for some years now, as you say. They're connected with the with IAPT services, which in themselves have been around a good many years now. But I still think it's a role that perhaps some people still haven't come across. And I think to hear about it in depth and to hear particularly, I think, about some of the things that can be challenging about that role, as well as some of the things that make it really enjoyable, was really, really well put across in that video. So thank you very much for recording that. I mean, in terms of questions coming in, the first one that stands out to me is really keys in with what you were talking about just at the end of the film anyway. Someone's saying, any tips for applying for these sorts of roles? What are the most useful experiences to have before applying? I mean, I think what you were saying is, think a bit widely about the sorts of roles you can have to pick up some related experience. But I don't know if there's anything more that you want to say about that, and what sorts of things you see in people coming in now for PWP roles.
Yeah, I mean, it wouldn't necessarily have to be a specific experience in certain services or anything like that. I think it would be anything to do with mental health or working with people in a professional capacity or volunteering, anything like that. It doesn't, we have people who are from a nursing background, or we have people who have just volunteered in the Samaritans and for a long time. But it's being able to have worked with people and maybe managing if someone is at risk towards themselves, and what can you do, how do you handle that, and having experience in that is going to be kind of one of those things that they're going to look out for, maybe in an application. Working with maybe questionnaires that we do around mental health or diagnostic tools, speaking through symptoms of maybe anxiety disorders or depression, knowing a little bit about that, which of course, maybe if you've done a psychology degree, you might know a little bit more about that from that. But as I mentioned at the end there, you don't have to have had a psychology degree to apply. For those cases, though, it may be that the experience would need to be a little bit longer. So you've worked in mental health for a lot longer, so that you've got more of an understanding.
So it sounds like, thinking widely about what are the things you can do to get some direct experience of kind of working with people, particularly people who are experiencing some sort of, mental health or other difficulty. And that can start in lots of ways often, can't it? With a local charity, you don't necessarily have to look straight to the NHS. There's loads of other opportunities to get experience out there in the voluntary sector. And I think absolutely what you say is right there, that there are now increasing opportunities to come into these roles from a non-graduate entry route. I mean, it may be that it makes sense to then have a bit of experience so that you're really clear about what you're coming into. But definitely I know that we in our trust have an apprenticeship route now coming into PWP roles, where we've really seen people coming in from a whole range of different career routes before, and often bring skills that you can sort of generalise, bring across from other areas. Really important, I think, for people to hear that. Someone has asked in the Slido, what other routes are there into the role if you don't have a psychology degree? So I suppose that's kind of what we've been talking about there. That does vary a little bit in terms of different programs, but that's definitely something that we're trying to grow and develop. So the other question I was going to put to you, Lauren, you heard about were you going to say something to that there?
Oh yeah, I was just going to say maybe it's worth mentioning, if you haven't done a psychology degree, the course is very slightly different, just in terms of the way that it's marked. So you're not kind of marked at a postgraduate level. So say if you're not used to going to university and working at that level, your essays and everything maybe are marked slightly less, or the referencing. But the other thing is you do have to do an application, like an entry essay, just to show that you are kind of able to work academically at degree level.
Okay, that's helpful to know, and I think I suspect that probably varies slightly how that gets worked out in different places on different programs, but it's certainly something helpful for people to check out on the way in, I would have thought. So the other thing I was going to ask you about was what you saw the video of the MHWP role. you know about the world of PWP, what do you think? What struck you as the kind of key differences or similarities between that role and the role that you've been doing?
That role before today's kind of conference, so it's really good to know that that is something that's coming out. From what I can gather from it, it's slightly, as those guys mentioned, they're working more within the community mental health team, which would what we would call maybe secondary care mental health. So an IAPT service would be primary care mental health team, and we would then do a lot of assessments where maybe these clients are coming through with these kind of more severe mental health problems, or they are at risk towards themselves. If we then feel that actually primary care isn't the right sort of service for them, we would then be handing them over to the community mental health teams, which from my understanding is what that role is then part of once they're in that secondary care, kind of liaising with, like they say, carers, family, and really supporting them there. Whereas our role would be, we do a lot of assessments to work that out, to make sure the client is in the right place, whether that's IAPT or secondary care mental health. And then we would provide low intensity treatment for those clients. With those clients, again, they should be within that kind of primary care level. We don't necessarily need to do as much in between liaison with different people. They're kind of able to keep themselves safe. They've got that, their responsibility is on them, which is probably the main differences.
Different service setting and kind of different demands, I guess. MHWP is probably working much more as part of a multidisciplinary team, but a lot of the actual, being trained to deliver an intervention, make a relationship with somebody and understand what their needs are and how you can support them, probably a lot of overlap there. We've had another question come in about what's the difference between an MHWP and a clinical associate psychologist. Now, I'm not going to put that to you, Lauren, and put you on the spot about that, but you might be pleased to know. It's a good question to be asked. Clinical associate psychologist is another newer role. It's one that we're also going to be factoring into the career map. There are some differences between that and an MHWP or other roles in terms of what exactly you're kind of trained to do as a starting point and how you fit into the workforce. What I'd say is watch the space, and we're going to be building in some really good, clear information about the CAP role into our career map over the coming weeks and months. So we'll give a good description there. There was one other thing which I was going to pick up, and now because of the need to be multitasking and darting around between different screens, I've lost it was. Can you train part-time? That's a question that came up earlier on. Is there a part-time route? My understanding is that varies quite a bit in terms of different programs, but I think there are some limitations to how available that is.
In terms of PWP course, you can't train part-time. It would be the university course is classed as part-time. You only go 1 day a week, but the other 4 days you have to be in service doing your clinical role, and it is a funded one, so you're getting paid kind of full-time. I think the other difference to maybe the other guys training is that we don't necessarily have that 2-year thing where you have to then stay with us afterwards. So it's
important for people coming into any of these roles to know that is that's a newer development, that in any of these HEE funded trainings, which would include MHWP or PWP, there is now the expectation that certainly you can't apply for another HEE funded training within a 2-year period. So essentially you have to kind of remain in that role and and commit to that role for 2 years before you can go on to the next training. So there's more information that's recently come out about that actually, and people can be reading more about that, but that certainly is a requirement of some of these roles. There was one other question asked about, if you train as a PWP, can you work as an MHWP? And no, that isn't how it works, because although there's lots of overlaps, they are distinct roles with distinct sort of skill sets. So you train in one role and then work into that role. So, Lauren, thank you very, very much for coming and being with us today, and also for sharing your experience of the PWP role. I think it's a really, it still seems to me a fairly new role, but one that, many hundreds, probably thousands of people have been through now, and it's a really rewarding, part of people's career journeys, and increasingly something that is a career route in itself, because there's more and more kind of levels of seniority being established in the PWP kind of workforce, isn't there? I know you were saying you're hoping to stay and kind of develop your kind of supervision and management skills as a PWP.
Yeah, definitely. I think there's that role of, do you want to go on to be a more high intensity kind of CBT therapist, or kind of overseeing new trainees coming in and doing the PWP role, which is kind of where I'm at the moment. You never know, I might want to do another university course in a few years, see where I am.
Well, we wish you well with it, Lauren. We've had someone coming in from the chat saying that the new PWP curriculum is asking all courses to develop a part-time route, so watch this space on that. That's a helpful interjection there. So we're now going to move from PWPs to our next profession ending in P, which is the EMHP role, the Education Mental Health Practitioner. And we're going to hear from Freya and Saba, who are going to tell us about their experiences of working into this role. So over to them.
Hello, my name is Sabhat Malik, and I am an Education Mental Health Practitioner. I work for Oxford Health, and I am based in the North team, which is located in Aylesbury.
So I'm Freya Waller, and I have recently qualified as an EMHP. And if you don't know what that is an Education Mental Health Practitioner. And I'm based in the Bucks MHST, so the Mental Health Support Team, and I'm based in Aylesbury. And if you're wondering what a EMHP is, so basically it's a practitioner who works in high schools, primary schools, colleges, and we can deliver low intensity cognitive behavioural therapy to young children and people, so I guess from the ages of around 6 to about 18. And we can support them in terms of their anxiety, their mood, if they've got behavioural difficulties, especially for those primary school age children.
So I actually did education studies as an undergraduate, and I felt like I needed a little bit more of an intellectual challenge. So I went on and I completed the Masters in Psychology, and that's kind of where my love for clinical psychology kind of arose. And then as I was kind of looking into jobs, kind of obviously as a graduate you start looking into the assistant psychology kind of field, but I came across the education mental health practitioner role and kind of looking at the green paper context and how much of a need there is in schools. And because obviously my background merges both education and psychology, I then applied for this role and I was successful in securing the position, and I've been doing it for 3 years, going on 4 years now.
So I guess my journey to go into this role really stemmed from when I did my undergraduate degree in developmental and educational psychology, and I knew that I really wanted to work in children's mental health. And to be honest, I wasn't really that aware of all of the roles. I was just applying for assistant psychologist roles and things like that, but I wanted some experience working in schools first. So straight after university, I graduated, I went and worked in a primary school as a teaching assistant for 2 years. And then after that, that's when I started to look for those roles. It was understanding the fact that there was, I guess, this big push for support in schools. And I think that really did highlight to me, because when I was working in the primary school, I could see students who really did need that mental health support, even at that young age of like year 4, year 5. And I feel like now that I'm able to be that person to give the support, on reflection, I wish that I almost looked for these kind of roles sooner. So obviously I've spoken about how my background is in terms of coming into this role. But I guess through the training and through joining my team, I've also realised that some people's backgrounds, they're all completely diverse. So not everyone has gone to university and done the stereotypical kind of that psychology degree. For example, when I was on my training course, there was someone who had done like a politics and history course, and they had been working in a CAMS, I think in Hertfordshire, and they had been admin assistant, and they saw the passion that the practitioners had, and they really wanted to be part of that. So they applied and they were successful. Within our team as well, in Bucks, we've got people who used to be counsellors, and they've kind of bridged, I guess, their training and furthered their training to become EMHPs. And we have people who have used to be those behaviour support people, so in children's homes as well, that have come and joined us and have all been successful. Thinking back to my training as well at university, I remember some people that were hairdressers before, and they just had a real passion for children's mental health. And I guess what I would say is, in terms of this role, I think the more diversity that we do have, if we're thinking about those protected characteristics of people, it's really important that we do have a diverse workforce. If everyone is the same, what are we bringing to this role?
Training was like as transparent as I can be. It was quite full on, but I think that's very important because you are dealing with, real life issues on a day-to-day basis. No day is the same. And I think that rigorous and that thorough training is definitely needed, because it's the one kind of qualification that I can look back and I do use everything that I learned.
Starting the role, my first day at work was actually at university, and because for part of this job you are doing uni full-time and work full-time at the same time, and I guess the first time that you do start doing that university, what it looks like really is that you are in Monday to Friday for the first 3-4 weeks, and that's really, I guess, teaching you the bare basics of low intensity cognitive behavioural therapy, and also gives you the groundwork for doing the assessment, because obviously when we first initially see young people, it's really important that we are doing these mental health assessments, including risk assessments, just to make sure we can get the biggest picture of how to best support this young person.
I think that making changes to young people's lives every day, and even children whose parents I work with, it's very rewarding. Obviously, working in mental health, it can the pressure can build up and it can get a bit too much, but when you reflect on your your highs, you forget about all of the challenges. And also just the rapport and the professional relationship that I can create with my young people. I am a very creative person, very let's get doing rather than just sitting and reading through resources. And I think that has made such a huge impact on my young people because we have brilliant relationships.
I remember my first day of university. Obviously my background is from a primary school, and so I really engage really well with those younger children, those primary school ages. And I remember they said, so the evidence base suggests that for one-to-one work with young people, it suggests that from the age of 12 upwards is where we do the one-to-one work with the students themselves. And for primary school age children, actually that's more parent-based work. And I remember sitting there thinking, oh my goodness, what have I got myself into? But actually now I really, really like working with those college and those secondary school children aged students, because I feel that I'm really supporting them and they can be really invested in the support that we give. And I think you're able to build that therapeutic alliance really well with these students, and you can physically see the difference in them.
So, when young people come to you who are obviously, doing quite bad, or they're not managing or coping very well in their lives, hearing their stories, that can be quite challenging because it's not one of those jobs where you log on at 9 and you log off at 5 and you forget about it. Some of the stories really come home with you.
So the training year, what I found quite tricky at times was juggling that balance between university and work. And there were times when I think you just have to be quite boundaried, because there were times when I was at university, and because at this point I was seeing clients, obviously these clients are on my caseload, I hold their risk. So if there are any changes to their risk or anything like that, obviously those are matters that I do have to deal with.
Because clinical psychology became a huge passion of mine back when I was in my master's, in particular eating disorders. So that's something that I'm really passionate about, but I have a few short-term goals that in my personal life that I'd like to accomplish before I kind of go on to do the PhD, because I want to give it my 100%.
I think that my end career goal would be to go into clinical psychology, and I think in terms of the training for that, I think it would be quite interesting to have that wider aspect, because obviously you train in more than just, for example, my passion is child mental health, but I will be trained in more than just that. And also I really want to, I guess, link in and stay involved with mental health support teams, because I think offer so much to not only schools and young children and the kind of the students, but I think in terms of the community, this is going to be quite a way down from where I am at the moment, because I'm really enjoying what I am doing. But I think also what I would say was, especially within our team, within our mental health support team, there's a lot of career development. So I guess clinical psychologist is like my end goal. But before then, I perhaps might have an opportunity to become a senior EMHP or perhaps a supervisor. Our team is kind of ever expanding, so there might be opportunities to be a team lead. My words of advice would be to trust your gut, and even when sometimes the training might be quite tricky, lean on those people around you for support. And I guess just really kind of keeping an eye on yourself as well, making sure you're looking after yourself, doing that self-care. If things are getting too much, making sure you're talking to people for that support. But it is such a rewarding job, and also being really reflective throughout the whole process. It's just, it's a great job. I love it so much. I feel like I could talk anyone into the job.
I would say that because I've been a trainee before as well, it can be quite daunting, oh my God, I have to do these assessments, and that includes risk, and they might come out and they might say anything. It can be quite daunting in the beginning, but just know that the training is there because, well, first of all, you've been offered the position because the people who have interviewed you, they can see potential in you, and second of all, the training is there to train you up, to upskill you, and it definitely helps you in your practice. Practice makes perfect. And just be yourself. I've noticed in my sessions, as while sticking to my professional boundaries, as much of myself that I can be, it really bounces off on your young people, and you get the same energy back from them, and they're open and honest with you. So yeah, if you're thinking about it, take the leap, do it, because it's probably the best things I've done in my life.
So here we are back again. So thank you so much, Freya and Saba, for recording that for us. I think you, you said, Freya, at one point you think you could sell this role to anyone. I think you nearly sold it to me in the course of what you were both saying there. I mean, the EMHP role is, is different in some ways, the MHWP and the PWP, isn't it? Because it combines a training in actually applying specific kind of, psychological interventions to individual young people, but also working with schools to think more generally about mental health awareness and the school's capacity to work with people with mental health difficulties. I don't know if either of you want to say anything about that and about how those different bits of the role fit together.
I'm quite happy to kind of start it off. So definitely, I think something as well that we do as well as our job is we do help to support schools in terms of building a whole school approach. So additionally to those one-to-one interventions that we do. So earlier on, they kind of spoke about graded exposure and brief BA. So we do that as well. We'll do worry management also. But we can also do assemblies, workshops, groups, and I've done all of those things since September. And so it's really a very diverse job, and you're doing the same thing every single day. But I guess it's about changing the school culture of what is mental health and how it can be supported.
So it's a really kind of rich role with different bits. Saba, do you want to say something more on that?
I'm just going to say on the back of what Veri has just been saying, that like yesterday I delivered staff training to secondary school teachers. So sometimes it can be difficult for teachers to kind of understand what's going on for a young person, and they may label it as, misbehaving or, not really engaging. So I think the beauty of this role is that you don't just see your young people one-to-one, and you're not just making difference to one young person's life. It's more about doing it as a whole school approach so that everyone understands what mental health is, and again raising that awareness of who we are, and if they need the help they can reach out to us, because we've been going on for a couple of years. I was one of the very first cohorts, and it's been going on for quite some time, but still some schools don't know about us, or if they, they're one of our schools but they might not engage as well because they're not particularly sure what it is that we do. So we do try our best to kind of support the school as well as our young people.
And in that sense, I guess it's a demanding role in the way that you're having to make relationships with those individual young people, but also with whole schools. Some of which I'm sure will welcome you in with open arms and be ready to work with you, and maybe others take a bit more convincing. That they're going to know what to do with an EMHP resource. How has that wider kind of engagement bit been? Because that's a lot to be taking on, I guess.
Within our team, we're quite lucky that we're based over High Wycombe, Aylesbury, and also Amersham and Chesham, and we cover so many schools. And I think individually we probably all at least cover, I want to say at least 5 or 6 schools. Some it might be higher, some it might be less. So there might be primary, high schools, colleges. And I guess my first advice would be, when I was training, before I'd even seen any one-to-one clients, was building up those engagement skills with the schools, getting to know who to ask, because quite a lot of our sessions are actually in the schools. So we do, I guess, more than being in clinic, we are in the schools. So you do make friends with the receptionists. You get really quite well communication with the SENCO, the safeguarding officers as well in schools. So you're really, I guess, building those relationships up within a school is also a really great impact that you can have with the school.
Oh, Sabra, I think you're trying to come in.
Oh, can you hear me now? So we have consultations that are set up with our link worker in the school termly. So that's where we'll go in just to meet with either if it's SENCO or, the SMHL, and that's who we'll speak to about, the things that we can put in practice. So if it is workshops or assemblies or what they think that there's a need for. So kind of actually having communication with that person in the school so that they can then spread that information to the rest of the staff, so that, we're making ourselves known.
So to come back to the training, so I suppose the two things that I kind of picked up of what you were each saying, I guess, Freya, you were talking about the wide range of different backgrounds that people were bringing into the training in terms of different kind of careers that they'd followed before, but also in terms of the diversity of kind of personal backgrounds that people were bringing into the work. And I think you rightly said how important that is, that the workforce represents actually the population of people we're seeing. And I know that we do see in these newer roles, and I think it's a really positive thing, that actually the makeup of the workforce across dimensions like race and ethnic background is much more representative of the population than in some other roles we see in the health service, which I think is really, really important. And you both, I think, were saying it can be quite full on, the training, which I think is a fair thing to say, isn't it? It's not an easy thing to do. What was your experience of that, and what tips would you offer to people considering coming into a training like this? Shall I come to Saba first? Sorry to make it, otherwise it's not clear where we're going.
No, I would definitely, like one of the previous trainees said, that being organised is definitely key. because like I said in video, that it's quite rigorous, quite thorough. So they will be they'll teach you something and that will have an assessment pretty much straight after. And also I would say definitely be organised for your end portfolio, because we also have a clinical practice outcome portfolio. It's quite a lengthy portfolio. So I would say, like, when they give you that checklist, start working through that slowly as you're going through your training. So anything that you can tick off early on, definitely do that. And dedication, it requires a lot of dedication. Sometimes things can get too much, especially being in mental health. No day is the same, so sometimes someone's story might affect you more than your workload, but it's about reaching out for support for yourself to support your own mental health as well. So yeah, that's my kind of top tips.
Fred, you want to add anything to that?
Yeah, I was just going to say, so earlier, and correct me if I'm wrong, but I remember for the other trainees, you were kind of saying that you have 8 clinical practice outcomes, whereas I qualified early October and we had 18. So it's very different, but obviously it's because of all the different things that we do have. So we have the education side, the engaging with schools, but also the engaging with one-to-one sessions. And then kind of building up the assessment skills, the engagement skills, the risk assessment as well. Because like Saba said, I think maybe what's different from our role is if a child is to disclose something, we do have that safeguarding need in mind. And I guess in part of the training does support you with that. And like Saba said as well, using clinical supervision as well. So whether that's your one-to-one support or in that group setting where there's quite a few of either sometimes qualified, but it does tend to be trainees altogether, and leaning on each other and supporting each other when you do need it.
And I think that theme of seeking your own support and making sure that you take that support need seriously, I think is a really important one, not just for the EMHP role actually, but for all of these roles we've talked about today, because they all do, involve meeting with people, hearing about people's circumstances, often hearing about, really traumatic, difficult things that people have experienced, and taking seriously our own support needs in working with that, I think is really important. So we've had other questions about progression. What is the career progression like as an EMHP? Now I know that's a moving thing at the moment, isn't it? And there's we're just at the beginning now of seeing the establishment of kind of training to go on and become a senior EMHP, and that's kind of part of the evolution of this role, following the path set down by PWPs. I don't know if that's something that either of you two have been hearing about in your day-to-day work. Freya, you're nodding.
We do. We have senior EMHP roles actually coming out for Oxford Health in January, but also some of the trainees that started with me back in 2019, pretty much all of them have now gone on to be supervisors. So some of them are now training and some of them are already qualified. So at the moment, progression is looking like supervision or senior roles.
Thanks. Well, yeah, that certainly fits with my understanding. So it's really good to hear that that's what you're seeing happening in practice, and important, I suppose, people out there to know that there is progression in these roles now, but the plan is that actually there will be more and more opportunities as these roles become more established and the numbers grow, and indeed there'll need to be more kind of supervision and more kind of senior roles in order to support this workforce as we grow and develop over time. We've had other questions about, we've had somebody defining the term SENCO, so that's very helpful. There's an acronym that had snuck through the acronym filter, so that's there defined in Slido, which is helpful. There was somebody who asked, and I can't quite find the comment now, but they'd asked, can you give us an example of an intervention that you're trained to deliver? So Freya, can you give us an example of a kind of one of the interventions that you're trained to deliver to children, to young people?
Yeah, so for example, this morning I was seeing a client who has quite low mood, so we were doing brief behaviour activation, and what that looks like is really helping that student to identify the areas of their life that really matter to them and encouraging them to try more of those activities. And I guess helping them to understand that when you are feeling quite low, you're almost in a negative cycle. Your thoughts are quite negative, might lead to you not wanting to do activities you used to enjoy, and your passion for things kind of dies down. So our work is really helping them to highlight that that's okay that you're feeling that way, but what can you do? We kind of give them the tools and the strategies to help them identify they're feeling that way, and helping them to do more activities that are meaningful for them. And I guess that helps them to understand that by doing more of those activities, you might start to see a change in your behaviour. That's just one of the several kind of things that we do in our day-to-day work.
Wow, so I think that's really helpful, a really good, clear description there of behavioural activation. That's an intervention that I think PWPs and MHWPs would also know about, although they might come to it from a slightly different angle. And I think, really, really well explained. Another question which I think came up earlier on, but perhaps is equally relevant here, is do you do any online work? Is this all face-to-face work, or are you using online platforms to work with any of the children and young people? Saba, what's your experience of that?
So luckily for me, when I was training, glorious COVID hit us. So a lot of my work was online, predominantly it was online. So ever since then, we do offer it as an option, especially when we're working with parents who are finding it hard for either, arranging childcare, but they still really want to access the support. So we do FaceTime, we do face-to-face work, and then we do offer support on Microsoft Teams as well.
That's helpful, and I think that will be this. There's certainly some online work for MHWPs. There'll be some possibility of that. A good chunk of the work will be face to face, but there'll be some options to do some work online. I think probably PWPs will often find they're doing a lot of online work, although that will vary a bit by service type, and as is the case everywhere, IAP services are often looking to see how they can be bringing in more and more face-to-face opportunities as time goes on. So we've had a couple of questions. Some of them are a bit more general. We've had a question about what's the pay. I mean, that's a reasonable question about anything. So EMHP roles, whilst you're training, you're paid at a band 4 in the NHS Agenda for Change kind of framework. You can look that up and see what that amounts to. And then when you qualify, you come in as a band 5. And that's the same for the PWPs and the MHWP. So all of these roles are kind of set up that they sit at the same sort of bandings, and that's part of what kind of ties them together as equivalent roles. There was another question, hang on a moment, which had a slightly more general flavour to it. I'm just working my way back down. There was somebody had reminded us more about, yes, that you can come into these roles with any degree. It doesn't have to be psychology. That's definitely true. Oh, there you go. Somebody in the chat has answered the question about the pay. So there you go. That's a double confirmation. And going on to say that those senior EMHP roles or senior roles from the other disciplines are coming in at band 6. So again, people can look up and see what that amounts to. There was a question about what the balance was in your training, how many days a week you were in university, how many days a week you were out on placement. I don't know if one of you just want to answer that. That's a kind of straightforward question that people might find it helpful to know about. Freya, do you want to say that?
Yeah, I think it depends on what university you go to. Because within our service, we have trainees who have gone to the University of Reading, but we also have trainees who are in the University of Southampton. And from my understanding, the University of Southampton, they are always in university on Thursdays and Fridays, whereas my training at Reading was quite different. So I think I said in the video, the first kind of 4 weeks, you're in uni 5 days a week, learning those core principles. And then kind of each term, you drop down a day. So after the October half term, we were Monday to Thursday. And then after that, it was kind of, we were always in service Thursdays, Fridays. And then after Jan, it drops down day by day by day. So it really, at the start of the year, it's very uni heavy because there's so much content. But then towards the end of your training year, it's a lot more in service. And I think that goes back to when I was talking about being quite boundaried. When you are at university, yes, you do still have responsibility for those clients on your caseload in terms of their risk, but it is that balance of work life and also university life, because it is an intense year, but you feel such a release and you feel so proud of yourself when you have come to that end.
Yes, it's a really rewarding journey, I guess, to get your way through. So we're coming to the end of our time, so I'm going to come to each of you and ask, as a way of finishing off, what would be your one top tip for someone who's sat here in the audience watching, thinking, wow, this seems like a role I'd be really interested to getting into. What would be your single sort of top tip to them of what they might be doing now in terms of picking up experience or doing some other learning or reading up a bit more? Saba, what would you say is your top tip for people out there watching?
I don't know if there's that much of a tip, but I would just say if you're thinking about it, just apply for it. That's what I would say. If you're thinking about it, just apply for it. And if you're here and the EMHP role has stuck out to you, then I would say go for it.
Advice. Freya, what would you say?
I think I'd say quite similarly, if you have a passion for working with children's mental health, every day is different. And I think for me, what's really rewarding is that the children themselves, you see that person, they start with you with hardly any, sometimes they don't think they can achieve it, and they really can. And so if you think that you want to be a meaningful part of a child's life in terms of they might remember you when they're a parent themselves, and being part of that journey, I think it's amazing.
Well, Freya, thank you very much. You've sold the role to us all over again at the end there. Thank you to you both for recording that film for us and for being coming along today to take those questions. I think that's been really useful, really informative, and really good that we've been able to respond to some of the questions picked up in the Slido. So we're coming to the end of our time for this afternoon. It's been really great to have all of our panel members with us this afternoon. I think it's been a really fantastic session. I see there's been some really nice feedback coming in the Slido. Somebody had asked if Sam and other participants could be moved to the northwest, and I'm afraid the answer to that is no. Not that I wish to control Sam's freedom of movement, but I think we're very happy that we've got such fantastic colleagues here with us in the southeast, and great we've been able to showcase the experiences of people from all across the southeast this afternoon. The other particular acknowledgement I wanted to make is to Lindsay Dawn. So Lindsay is our Senior Assistant Psychologist here in the PPN in the South East, and has done a massive amount of behind the scenes work, editing these great films and putting together this session for us this afternoon. So my big thanks to Lindsay, who's done a fantastic job of that. And also to Sharon and Helen, our experts by experience in the PPN Southeast, or two of our experts by experience in the PPN Southeast, who've been part of the planning of this session from the outset. So although you haven't seen them today, their contribution to this session has been really critical, and we really value their input to the network. So that's all we've got for this afternoon, except that once again I want to flag the career map. Like I say, we're doing some screening and some tidying up with the career map at the moment, so it will change over the coming weeks and months, but it remains a really good resource to check out all of the different psychological professions roles and to think about which ones might be applicable to you. Many of the practical questions we'll have asked in the Slido will be answered on that site, so do check that out. I can see that the Slido window for feedback is open, so do give us your feedback about the session this afternoon. We're really keen to take into account your thoughts and comments in planning future sessions. Thank you once again to my panelists. Thank you to everyone who's tuned in this afternoon, and goodbye for this afternoon. Thank you very much indeed.